Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Well, today we have a very interesting topic for you. We're going to talk about skin-related issues and in context with the changing seasons. So we've had a hot, brutal summer, and now the weather is changing. We're going to enter autumn and then from there on to winter. How does our body react? What changes do we need to ensure so we don't land into trouble? So for today's program, we're very honoured to have with us in the studios Professor Ikram Ullah Khan, Head of Department Dermatology, PIMS, and Consultant Dermatologist. Thank you very much, Dr. Ikram Ullah, for joining us here today.
Thank you very much. It's always a pleasure to be in your program.
It's always a pleasure to have you as a guest as well. It's always a very informative program. Our viewers come around with lots of information and we always get great feedback, which also shows that skin-related issues are, they're immense.
Absolutely. Skin is the largest organ of the body and obviously, that is something which is visible. Anybody can, any person can detect if there is something wrong with the skin. If something wrong is with the heart, liver, kidneys, you do not detect unless and until it becomes bad and show very bad symptoms. But skin, if there are mild changes, you notice that.
That's
and one would like to seek attention.
Absolutely true. And also another thing, it seems that people are much more conscious of how they look now. If we sort of compare to about 20, 25 years ago, maybe looking good or having great skin wasn't that much of a priority. But now things have changed. Everybody wants to, tie in the actual connection of looking good and feeling good.
Obviously, when they have got options, 25, 30 years ago, options were very, very limited. But now there are so many options one can seek and one can have. And obviously, like everybody would like to look good. Even if you go 200 years ago, one would like to look good. They would dress up and they would, make sure that skin is looking good. But at that time, options were very limited. But now if somebody does not have a very good skin, there are options available. There are different treatments available which the patient or a person can utilize and can improve their skin.
Right. Okay, so today's topic is very interesting. It's very important and very relevant as well, as we're changing in from a very, very hot summer, which of course had different requirements from us. For our body needed, our skin needed different requirements. Now here comes autumn, and from autumn we go into winter. Now, what does our skin go through? What are the changes, and how do we need to adapt?
Okay. Now, the first thing that whenever winter sets in, we all put heaters in our room or wherever we work. Over there are different types of heaters. The most common heaters that are used here in Pakistan are the gas heaters.
Right.
Because as compared to electricity, gas is cheap. And obviously one would resort to gas heaters. Now, one of the drawbacks of the gas heaters is that obviously it's a fire, and already in winters the humidity becomes very low. Humidity like for example in Islamabad, the humidity goes around about 20 or 15, so it becomes that low. So in that low humidity, the skin dry up, and whenever the skin dries up, there is redness, inflammation. One tend to scratch the skin because the skin become itchy. If your skin is dry, your skin will itch. When you will scratch, it will lead to some injury to the skin, and that is a portal where infection can or bacteria
and sort of
can
a vicious
go
cycle, isn't
inside the skin, and it's a itch scratch cycle, and your skin become from bad to worse.
Okay.
Now, when you use these heaters, already the humidity is low. Like when you use these heaters, the humidity becomes very low. So in that situation, I would advise and recommend that one should have a humidifier or there's a small little instrument that produce humidity in the room. That is very important, so that the humidity does not become less than 30. That is very important to note these points.
Okay.
Now, humidity.
How will we know the level of the humidity?
There is a small little gadget. Most of these humidifiers do have a small. They show what the humidity is of the room. But there is a small little gadget that is available in the market. It costs about 700, 800 rupees.
Okay.
And you can fix it on the wall, and it will show you the temperature. It will also show you the humidity.
Okay.
So humidity, anything less than 30 is something that will dry up your skin, because then the moisture will start coming out of your skin. Your body will not be able to retain the moisture. And in that situation, the skin becomes dry up. So make sure that there is a small little humidifier in your room that will create humidity, and the humidity does not become less than 30. The ideal humidity is 50%, where the skin, you know, remains fresh. The moisture that is there is retained inside the skin. Now, like we were talking about different type of heaters. Now, one of those heaters which actually totally consumes the gas and it makes very little carbon monoxide, those are the heaters that are best, but they are expensive. What in fact is the most I wouldn't say convenient, but which is the best way, obviously we are talking over here, the best way to heat up our room is that we should have proper insulation of our walls. Obviously we should make our houses so that they are well insulated. The windows, you know, they are also well insulated. There are no leaks in the room where the cold air can set in. Plus, obviously there must be some ventilation also. Now the water heaters, they are very good. They do not, you know, they are something that produce a very pleasant heat. You can utilize the same boiler that heats up your water when you take a shower.
System,
It will also, you can utilize that boiler to heat up your room also by fitting a small little water radiator in your room or wherever your living place where you're living in. So that is something, the heat that is produced by that particular water heater does not consume so much of the moisture, and also it does not produce carbon monoxide. That is very important.
Right.
Now, when we talk about the humidity, the other thing that we talk about the heater, the gas heater, is that they
harmful effects, carbon monoxide.
Carbon monoxide. Now, carbon monoxide is very bad for our health, let alone the skin. So these are the points one should take into consideration. And whenever, you know, obviously the winter is setting in, so we should wear warm clothes, stuff like that. Skin dries up, one should
Any
regularly...
fabrics that give you sort of allergies, skin allergies?
It all depends on the patient. Some patients are not allergic to wool, so wool is very good because it's a natural thing, but some patients are allergic. So one can have something made up of cotton. Obviously, with padded cottons, they can, you don't retain your body heat, and that is also good enough.
Right.
Now, use of moisturizer in winters is very important. One can have, there are different type of moisturizers.
Sorry to interrupt you. Can you use the same moisturizer that you're using in summer? Can you use the same one in winter, or should you have a different set of
Obviously, you can use the same moisturizer, absolutely. But there are different type of moisturizer, like occlusive moisturizer, like you know, those petroleum jelly type stuff which you slap on your skin and it sort of seals the pores, so it retains the moisture inside the skin. Then there are moisturizers that goes inside your skin, into the dermis, and they moisturize your skin. Those, I think, are more preferable because, you know, cosmetically they look good because your hands and your legs and your feet, your body does not feel oily. If you use something sticky, you will not be able to wear your clothes. It will stain your clothes. So these other moisturizers, they are very good. Moisturizer that has some urea in it are very important.
Okay.
Because urea-based moisturizers retain water. They have got the largest water retaining capability, and the moisture that have got urea is very good.
Okay.
Moisture that have got aloe vera also, I also recommend that also, because these are the type of moisturizer that will be absorbed inside your skin. It will not make you feel uncomfortable when you are wearing it, and it will moisturize the skin for 24 hours.
What's the best way to use aloe vera if you have a plant at home?
Honestly, you know, like the raw moisturizer, as such, I do not recommend, though there is no harm using it. A lot of people use it, and if something is not available, then that's the best available option. But the moisturizer that is available in the market, all this aloe vera is processed. It has certain ingredients that are irritant to the skin. Obviously, it is of plant origin. Some may be allergic to some of the ingredients that are not necessary to have on the skin. If you're using a raw aloe vera, it has got all those allergens in it, and it may, in some patients, give rise to allergy. So I would recommend that use the processed aloe vera that is available in the market. That is something, it get rid of all those irritants, and it's something which you can easily apply. You cannot be all the time, you know, going to the garden taking out the poor plant and putting in a juicer and extracting the aloe vera. So that is a bit of a hassle also.
Yeah.
So if you have got that aloe vera in a bottle, you can judicially use that, and that is something I would recommend.
Okay, right. Another thing, lots of people asked us this question, that when it comes to like winter, and of course, people indulge in hot showers and a hot bath or something like that. What does that do to your skin and also your scalp as well?
Okay. Now, at times there are a lot of myth about taking a hot shower or a hot bath. Obviously, if you are using a regular moisturizer, some like hot bath at times make you, and like I myself take a hot bath or a hot shower, it relaxes you. It is something that warms you up. So it is good. It's not bad to have a not extremely hot shower or bath, but reasonably hot, moderate hot. That is if you feel comfortable, that relaxes you. So good enough. After that, use a moisturizer. It's not that it's going to give rise to dandruff. One of the popular
because that is a myth.
One of the popular myth is that if you are using a hot shower, it will give rise to dandruff. No, dandruff, it's a disease on its own.
Okay.
The worst form is
and it's not aggravated by a hot.
No, and its worst form is seborrheic dermatitis. Now, when the dandruff becomes worse, dandruff, which we in our medical term we call it pityriasis capitis, when it becomes slightly inflamed, it becomes worse. It is known as seborrheic dermatitis. Now, that is a disease on its own that manifests itself in the form of dandruff. Now you have to, that is not due to taking a hot shower. There are genetic predisposition which makes one prone to seborrheic dermatitis, and seborrheic dermatitis in most of my patients that I see, and generally all over the world, are associated with those patients who have got some amount of stress in their life. And
so stress is an aggravating factor.
Stress is an aggravating factor for seborrheic dermatitis or dandruff in the scalp.
Is diet as well?
Not exactly. Not exactly. I would not call. No, it has not been scientifically proven that seborrheic dermatitis can be aggravated with certain amount of diet. That again is a myth. So basically, the other thing that seborrheic dermatitis is common is with those patients who also have acne. So seborrheic dermatitis and acne go hand in hand. And both these problems, though they are primed by our genes, but obviously, stress plays a very important role.
In
that seborrheic dermatitis, that acne may remain latent, may never appear on the skin if the predisposing factors are not there. And one of the predisposing factors is stress.
Okay.
So these days we see a lot of patients with seborrheic dermatitis. Obviously, somehow or another, the stress level.
Is it affected by the weather?
Winters at times, sometimes, when you don't see the sun and there are clouds all the time, so generally make one a bit gloomy and depressed. Obviously, that is why in Europe and other countries, depression rate is more as compared to countries with a lot of sunshine. So obviously winters do have that little bit of a depressing role, but those are the factors, but not to a very great extent. So but it has it depends on the genetic predisposition and how you handle stress.
Okay, now let's talk about other issues as well. What about folliculitis? And is that something to do with the dandruff, or is it something completely different?
Okay, people with dandruff can develop folliculitis also, but the pathogenesis of seborrheic dermatitis, I would call it seborrheic dermatitis as dandruff. Okay, in medical term we call it seborrheic dermatitis.
Right.
Now, the pathogenesis of seborrheic dermatitis is quite different from that of folliculitis. Folliculitis is due to a bacteria known as Staph aureus bacteria. Some people do not have immunity against the Staph aureus bacteria, so they are prone to be infected by Staph aureus bacteria. This bacteria goes inside the hair follicle and give rise to inflammation that is known as folliculitis. On the other hand, as far as the seborrheic dermatitis is concerned, it is something that is genetically determined. Plus, there is a fungus that is involved in seborrheic dermatitis that is responsible to aggravate the condition. So the pathogenesis of two conditions is quite different. Folliculitis is one disease, seborrheic dermatitis is a separate disease. There is a possibility that the both of them can coexist together, but obviously they too are two different conditions.
And the treatment of folliculitis, is it just, for medicines and afterwards?
No, it depends where the folliculitis is. Okay. Now, let's suppose folliculitis is on the scalp or in the beard area. Then in that situation, the treatment is topical antibiotics and oral antibiotics. Because the immunity with Staph aureus bacteria will develop on its own. You need to develop that indigenous immunity inside your body against Staph aureus bacteria. So far, there are no drugs that will enhance your immunity against that particular bacteria. It's not that one person is immunocompromised, it's just that for that particular bacteria, one does not have enough immunity. Ultimately, body will recognize and will make immunity against the Staph aureus bacteria, and then they will cease to have folliculitis. Till then, one has to treat it with topical antibiotics and oral antibiotics. But if folliculitis, let's suppose, occurs in areas where, obviously folliculitis occurs in the area where there are hair. Now, for example, in the beard area, especially over here, in this area, most men get folliculitis. So I'd recommend that if they do laser treatment over here, get rid of the hair follicle, the folliculitis will cease to exist. If the folliculitis is occurring in the armpits, you get rid of the hair with laser, folliculitis will cease to exist because there will be no hair, no folliculitis, no infection of the hair follicle because that hair follicle will cease to exist. Similarly, other parts of the body where, especially women on the legs, when they do threading, waxing, or on the arms, they develop folliculitis very commonly. They can get rid of their hair and they will be fine.
How painful is laser hair removal?
It's quite tolerable. Obviously, the pain, there are different modalities to reduce the pain. There are chillers that cool the skin to -10 degrees centigrade, and at that temperature, one do not feel any pain if there is a little bit of a heat that is generated from the laser. So these modern lasers are quite painless. I would not say that it's totally painless, but they are tolerable.
They're tolerable. Are there any sort of topical anesthetic used for them?
Yes, topical anesthetic is used for some patients
who are a bit more sensitive.
More sensitive. A lot of topical anesthetics are well in different percentage, and they work very well.
Okay. We also had a question from a viewer. White patches.
Vitiligo.
Yeah.
Vitiligo.
The treatment, and one of our viewers was saying that he just developed this 8 years ago, and it is something that is spreading. What is the treatment for that? The right treatment? Because you find many other people who are giving alternative, facilities. So you're a bit worried that way.
Because I would talk totally in scientific terms. Now, the white patches, we call it vitiligo in our medical language. Vitiligo is an autoimmune condition. Antibodies are formed against the pigment-producing cells in our body.
Okay.
Those antibodies are formed by our own system. So it is an autoimmune condition, and patients with vitiligo who have vitiligo should also go and test their thyroid hormone also, because that again is a autoimmune condition. That is very important. The first thing that I would do when I see a patient with vitiligo, I do their thyroid function test and find out what other autoimmune condition is the patient suffering from. Now, the medical treatment for vitiligo is ultraviolet B light and ultraviolet A light treatment, known as UVA and UVB. You can combine the ultraviolet A light with Sorelins. It comes by the name of leucodermine tablet in Pakistan. Sorelins are something that sensitize your skin, and it sort of stimulates the melanocyte to produce melanin. And when you shine the ultraviolet A line or the A light on it, the result is enhanced, and the skin color start to come back again. So that is a scientific treatment for vitiligo.
What is the success rate for that?
The success rate in what I see in my patient, because I have a special room for patient with vitiligo with a full body chamber and other other machines, almost 80%.
That's quite high.
I am very optimistic. I never lose hope on a patient who have got vitiligo. I'm very, very optimistic that the condition is treatable. It's just that the ignorance that the patient have, that once the disease develop, they
because it's devastating for them, isn't it?
Obviously, it affects your personality. If the patches are present on your face, not in our society, in every society,
of course,
it is very devastating, especially in our type of skin, type 4, type 5. It is very visible because the skin complexion is slightly wheatish, and if there is a white patch, it looks very prominent. On a fair colored skin, type 1, type 2 skin, they are already very fair, and if there is a white patch, that is not that visible. But in our type of skin, vitiligo can be very, very devastating as far as the patient self-esteem is concerned. So the treatment for vitiligo is these machines, narrowband UVB and UVA. Now there is a laser also known as, the wavelength is 308 nanomillimeter. That again is very effective for vitiligo patients. The excimer laser, that's the name of the laser that sort of give this wavelength. So that hasn't been, but it is that is more expensive as compared to narrowband UVA and UVB. And if you compare the result, there is not much of a difference between the UVA or UVB treatment as compared to excimer laser. But obviously, excimer laser is also being used with a 308 nanomillimeter wavelength for patients with vitiligo with a very successful result.
Right. Okay. We hear a lot about drinking lots of water will give you fantastic skin. So how much of that is, how much water do we basically need? And especially in winter when we've spoken about the other drying effects of heaters and everything. So at that time, we tend to sort of cut down on our water intake. How much water should we be taking?
Basically, Allah Almighty has made our body in such a way that if there is any deficiency, we seek for it. If there is a deficiency of water in our body, we will become thirsty and we will drink water that is enough to, to replenish the deficiency that is there. Now, some people drink a lot of water. They drink 5-6 liters of water, assuming that will make their skin look better. In fact, that is not true. There is a limit to it. There is a balance to it. That whatever you drink should be balanced enough. Should be something that is not very excessive, and that is something which is not less than what is required. Our body, if we say in a normal circumstances, lose about a liter of water every day in the form of sweat and stuff like that. This is apart from when we go to the washroom and urinate. That is apart from that we call incessible. That's something that we do not estimate water loss. That is about from 500 ml to 1000 ml.
Okay.
When we have temperature, obviously that incessible, if I'm pronouncing it properly, the water loss is about 1500 ml or 2000 ml.
Okay.
So in that case, we should drink more water. But if on average, if I look at it, about 2 to 3 liters of water per day will be enough for our system if we have to really give it into figures. But obviously, body is something, we get thirsty and then we drink water. That is something which one should follow. But at times, there are certain people who are lazy enough not to drink, or they are sitting in one place, and even if they are thirsty, they don't feel that much. So in those patients, those people, I would recommend that they should make sure that they do drink at least 2 to 3 or 3 liters of water every day.
Right. Okay. Would that be the same for summer and winter? Would that, or
obviously
would you have
in summer it's more because the incessible loss of water in summer is more. But if you are out in the sun or you are exercising, you will be losing at least 2 to 3 liters of water in your sweat, which you do not calculate, and you have to. That is a deficiency that is created, and one has to restore that deficiency. And apart from that, body needs water for the metabolism. Whatever we eat or whatever our day-to-day activities, our cells, they need to be bathed in water, and they need water for proper metabolism.
Right, absolutely true. Okay, so because today's program is about the changing weather and it being very cold and everything else, you see lots of people complaining about, the hands and their heels and their feet as well. What's the proper care there?
The proper care is that, some people, one thing, some people are fond of washing their hands 1 million times a day. So I would recommend not to do that because that's an obsessive compulsive disorder. Obviously, one should wash their hand whenever they are eating or doing something, But too much excessive washing of the hand is something one should avoid. Using, like some ladies, or people who work in the kitchen and they wash the dishes or whatever, obviously they come in contact with the detergent, so that also dries up their skin and has an irritant effect. So obviously in winters the skin becomes dry, there is because of the less moisture in the atmosphere. So again I would emphasize to use a moisturizer all the time. For cracked heels, I would recommend that one should use occlusive moisturizer like petroleum jelly, and if they have to enhance the effect, if the cracked heels are not healing, then they can wear a sock on it so that the emollient or the petroleum jelly that you have used, it stays there or there. At times, if the condition is very bad, we in fact put polythene gloves or polythene sheet on that particular area where the heels are cracked. That helps very well, because then in that situation the moisturizer that sticks onto the skin, it is not rubbed off by our clothes, and in few days, 2 or 3 days, the cracked heels, they heal if you use a polythene sheet on it.
Okay, so let's talk about changing times as well. Before we used to have soap and water, washing our hands with soap and water, washing our faces with soap and water. Now we have different types of hand washes and facial washes as well. There are many people who don't use shampoo and they use soap. They're more comfortable with using soap as well. What is the difference there? What should a person be mindful of if they're using hand washes and face washes?
Obviously, again, I would say that this is a business. Obviously, if the soap is in the liquid form or it is in the normal solid form, it is one of the same. It is the detergent. Now, if you have got people are fashionable, if they then would like to use a facial wash and not use the solid soap, it's all up to them. But they work the same.
The function is the same.
Function is the same. Similarly, it goes for the shampoo also.
One thing I would like to say. Shampoos, sorry to interrupt you. You have all these shampoos making these amazing claims, and then you sort of think that you're just using it for a little while and then it's going to be washed off. So how does that?
They're all claims. No, there are certain medicine that come in the form of shampoo, like for seborrheic dermatitis, there is one chemical known as ketoconazole. That is very, because as I said that seborrheic dermatitis has got this fungal element in it. So ketoconazole is antifungal. So obviously it comes in the shampoo form also. So that is helpful in patient with seborrheic dermatitis. Other than that, all these fancy shampoos, and some shampoos are very, very expensive. I honestly fail to understand what is their advantage. Now shampoos that claim that they lead to less hair fall, again that is a myth. Shampoo has got nothing to do with the hair fall. There is no such thing as shampoo that will prevent the hair fall. Hair fall has a total different pathogenesis. Shampoo is not going to cure it. So obviously, if even very huge companies, foreign companies, when they write that it will lead to stoppage of the hair fall, that is a absolute plain lie. It does not do that. So if one is comfortable with soap, washing their hair with a soap, good enough. If one is comfortable with shampoo, good enough. So there is not much of a difference. At times the hair, like all the shampoos, some of the shampoos have got these conditioners and stuff like that that make your hair a bit silky, that looks good, or may the frizz that is there, or the static that is produced into the hair. Some of the shampoos
that can help that.
So in that situation, they do have an advantage.
Okay, I'll have to interrupt you there. We're going for a break, but don't change the channel. Welcome back to the programme. Let's have a look at this report. Okay, we've been having a fantastic programme here today talking about the effects of the changing seasons on our skin. Professor Ikram Ullah, you've been very kind to take time out of your busy schedule, be with us here today. Okay, now we like to hear from you, innovative, all those new things that are going on in dermatology and the things that people can benefit from. Tell us about melasma.
Okay, that's a very interesting question, and as we were discussing earlier, I have been in my practice for the last almost 30 years now. One thing I have observed very consistently, and I've been treating melasma with medicine, and I have got all sort of lasers available with me to treat melasma.
For our viewers that don't know, what exactly is melasma?
Okay. Now, melasma is abnormal pigmentation on the skin that usually appears in pregnancy. You see those brown patches in the shape of a map on the face. Very common problem, very common in our society, in
our part of the world,
subcontinent.
Are freckles and melasma something different?
Freckle is different. Freckles are more common in fair complexion people, and there are small little tiny dots present on the face. Melasma is a sheet of pigmentation that looks like a map, a dark brown pigmentation on the face. That is melasma, and usually appears in pregnancy in many patients, and can be to a certain extent stress related also, because stress promotes melanocyte stimulating hormone that leads to melasma. One thing I have seen very consistently in my patient with melasma, if I look at very carefully under a very high magnification, I see tiny little blood vessels around the melasma. Now those tiny little blood vessels are known as capillaries. Now those are useless capillaries that do not serve any function in the skin, because all the nutrient blood vessels that are there are deep in the dermis and they are not visible on the skin. These little tiny little red colored capillaries that are present on the face around the melasma are, in my opinion, to a certain extent responsible for the creation of melasma. My theory is that in pregnancy a lot of hormones are produced that leads to neovascularization. Obviously the placenta requires a lot of new blood vessels so as to support the fetus. So that same phenomena may give rise to capillary formation on the face also. Those are useless capillaries, and when they break, they release RBCs. RBCs have got hemoglobin, hemoglobin have got iron, hemosiderin that is responsible for brown pigmentation. I will give you an example. You must have seen patients with varicose veins, and if you look at their legs, they have got all sort of abnormal dark brown color pigmentation on the legs. There is a condition known as capillaritis on the legs. The condition is known as Majocki's disease, and that manifests itself as a brown patch on the leg. So this particular capillaries or capillaritis on the face can give rise to melasma. I have started treating quite a few of my patients with a laser known as pulse dye laser. It's a V-beam laser, and that's a laser, is a vascular laser that sort of get rid of these small little tiny capillaries, and I have seen dramatic improvement in melasma. So I'm going to investigate more, and I'm going to publish this in one of these international journals, my study that for treating melasma, the vascular laser has got a very great and very successful approach in treating the patient with melasma. So this is my theory. It has not been reported before anywhere in the literature, and I'm going to, whatever my theory is or my observation is, I'm going to document that very scientifically and going to publish it, inshallah, very soon.
Yeah, that's great. We'll be, really looking forward to hear the feedback from that, because for a person who is melasma is making their life miserable,
obviously,
then for them that's a huge breakthrough.
Yes, yes, absolutely.
So when patients come to you with melasma, what are their usual concerns? Are they sort of like, very, very conscious of it? And
patient with, obviously, melasma like the white patch, it's a very detrimental to your personality. Similarly, is the brown or the dark patch on the face. And honestly, I have seen young girls, beautiful girls, not getting married because they've got melasma on the face. I have seen marriages breaking down because of melasma on the face. I'm not exaggerating, I have seen that in my practice. And melasma in that situation obviously is a great problem, because if a person who has melasma, they are thinking about the melasma all the time, so they are not the productive member of the society anymore. So, you know, it is very important to treat this particular condition, because that is affecting the personality of that particular person who is having melasma. It does not look good to have this huge brown spots on the face. So that affects the patient morbidity. It's one thing is known as mortality, other is morbidity. Mortality is something you die from. Morbidity is something that affects you and you no longer are useful to the society or to yourself or to your family. That is morbidity, which is a downtime, like you're out of work and out of every social contact. That is the morbidity. So melasma, though it may not affect the mortality of a patient, but it certainly affects the morbidity of a patient.
Right, okay. Professor Ikram Ullah Khan, thank you very much for being with us here today. Unfortunately, we've run out of time. There's so many other things that we could have spoken about as well. We look forward to having you again on the program, because the information that is exchanged during, you know, shows such as this, we get immense feedback and people really, really benefit from this. So thank you very much.
Thank you very much. I'm always a pleasure and an honor to be in your program.
Thank you very much.
Thank you very much.
Okay, so with that we come to the end of today's program. Some really, really important points that Dr. Ikram Ullah gave us. Humidifiers, the importance of checking how much humidity is in the air that surrounds you will help you with your skin issues. It should not be less than 30%. Also, he said that moisturizers with urea, look for those as well, which will, you know, help you in protecting your skin during the harsh winter months. Also, if you want to have a bath or a shower with warm water or hot water, that is fine as well. And basically, soap and water will also do a great job for you as well. So until next week, see you next time. Bye-bye. Stay happy, stay healthy.